Yeah, look back and remember your number.
It's been a while since I put the number down. It's class around for a week. No.
I'll do that, well, that's wrong, just so you know, when you, any of you in an EMS class, any class, DFP class, somebody should be doing roll call. I don't necessarily agree with the new DFP stuff where if you do roll call up there on who was on the list, but you don't have a hard copy and it tags and doesn't upload. I got a mixed bag of people, how do I know who's who? But a no EMS still requires a wet signature, that if you're in a class, you should be asking for the roster. You should be asking for the roster. And then we had somebody just get hours that they shouldn't have got. And you better report that back to us because that's bad, that's a no-go. If you know you were in a class and didn't do it, you're just as guilty because you took hours you knew you didn't sit for. So just pay attention to that because once they get back on their feet up there, they're going to come out guns blazing. I can tell you right now because everybody thinks they're getting away with it. And they ain't. All right, good morning, guys. We have a guest speaker this morning. Kate has come to us from big old countryside of Middlesex. I met Kate in my ministry down at Yorktown one day. We were just outside talking a nice day and we connected. And she had so much to share and so much that I felt that you guys need this. We brought it into our EMT class, the last group that went through last year. And even though they didn't understand the depth of it because they were brand new, it definitely tells you why you need to do a patient assessment, why you need to get history, why you need to get allergies. Please engage her and ask her any questions you want. That makes this position for her in speaking a little bit easier. Don't be afraid to ask because she wouldn't be standing here and driving all the way over here with her medical history, which you'll understand when she starts speaking, just not to have that interaction and ask her questions because you don't get this opportunity very often, which is why we're fortunate that we've been able to bring it to you. So that being said, I'll let Kate introduce herself and the rest of her background.
Hi, I'm Kate. So I hope you guys took a minute to read that quote I had on the screen a few minutes ago. I had it somewhere else in my presentation, but I wanted to put it up here first so you had an actual opportunity to read it. My mom wrote that. This condition and the way I'm treated by the medical system and how it's failed me does not just affect me. It affects my family, my career, everybody around me. It's affected them pretty hard. So the way you treat a patient, either compassionately, medically, all of that goes together. It affects everybody, not just the person in the back of your ambulance. So I have Ehlers Danlos syndrome and company, formerly diagnosed by genetics. If you've never heard of it, you probably people don't know yet, but it goes with a lot of the conditions you are starting to see, like POTS and that sort of thing. So I'm gonna kind of go over the basics of it and then like the individual systems. I do other things besides being sick, even though that's most of my job right now. I love to craft. I live in the middle of the country. I go to the city when I want to see people, not when I don't do that on purpose. We have a dock with water access. Water is like my peace. Like that's where my brain goes to shut itself up. And I love concerts, love live music. I keep a list in my fridge of all the concerts I've gone to. I saw Hosier twice. This year is OAR, Blues Travelers, Gin Blossoms, and maybe Goo Goo Dolls. So if that gives you any idea. Also a huge baker. Please take them. I was anxious and nervous this week, so there is like 1 million cupcakes at my house and caffeine, and I found people listen better when they are fed and caffeinated. And then as far as I have a little bit different in that I have the complex medical history. I also have a medical background. Not human, but vet med. I'm a licensed veterinary technician, which is very similar to an advanced practice nurse. I can place IVs, I can intubate, I can place central lines, I can run a CPR, calculate CRIs, give narcotics, IVs, IV antibiotics, cardiac monitoring, that sort of thing. So I work critical care and ER overnight during COVID. So I got some stories we don't talk about, right? Fun ones on here is that dog is a hyponatremic hemorrhagic gastroenteritis that had cardiac involvement. So it was on and off different fluids and pain meds and Metro and had remote monitoring. That's a kitten that was kind of cute. I placed that IV. It was a 22 gauge in the jugular in a 2-day-old puppy that was cold and hypoglycemic. I got to work with bald eagles with Tommy. He was a rehabber. and a dog that ate a butter knife that we found a couple months later because we thought it was a lump. The body had sealed itself off around the stomach, and you can see where we thought the lump was. And then we're like, oh, that's weird. Took an X-ray, and we're like, oh, that surgery plan just changed. So that's where we were. So I showed you that one. And then, so this is part of the conditions I've been diagnosed with. It goes on and on and on. So all of this mostly comes from the hypermobile Ehlers-Danlos syndrome, which I'm going to go into for a minute. I have mast cell activation syndrome, which causes severe reactivity to like triggers, like almost like allergies, but it's not true allergies. I have POTS with SVT. I have a paralyzed stomach, my gastroparesis, I have trouble swallowing, and my intestines don't work. I have abdominal vascular compressions. I am classified as an adult failure to thrive. I am TPN dependent. I have a central line and reliant on nutrition via my heart to live right now. That's basically both failure to thrive is you can't keep yourself alive. Adrenal insufficiency secondary to chronic steroids. Joint instability, most of my joints dislocate or subluxate multiple times a day. Immune deficient, ASD, bipolar 1, migraines, osteoporotic. List keeps going and they keep adding. This week was intractable migraine. So, yeah, I look better than I am. So there's 13 types of Ehlers-Danlos syndrome. Ehlers-Danlos is a connective tissue disorder. A lot of doctors still think it's just bendy joints. It is not just bendy joints. You have connective tissue in your entire body. So think anywhere you would have collagen. It's a collagen deficiency. My body doesn't know what to do with it, and it degrades over time. So you have it in your joints, you've got it in your nerves, you've got it in your heart, you've got it in your GI tract. You know, it's everywhere in your whole body, and once that starts going, it just keeps tumbling. There's 13 types of EDS. Hypermobile spectrum disorder and HEDS are almost the same, and I'll go into that in a minute. But if you hear somebody give you a history and it says they have Ehlers-Danlos syndrome, there are certain precautions you need to take, certain things you need to remember to ask. And if they say one of those red ones, run, please, run. Connective tissue disorders, these are ones that are not Ehlers-Danlos, they're separate. Marfan's osteogenesis imperfecta, which is brittle bone disease you've probably heard of, and Louis Dietz. Those all come with severe manifestations as well. Vascular, they're prone to organ rupture and aneurysms, and fatal by age 40 from that. It's the only type of terminal Ehlers-Danlos. So if somebody says that in their car accident, you don't really want to find out if their aorta is gone, right? Classical and classical-like also tend to have more symptoms of organ involvement and skin involvement as well. Their skin can literally tear just from touching it. So, any questions so far? I don't like talking to myself, so ask.
Which one category are you considering?
I'm hypermobile. I'm going into that. It doesn't mean it's less severe. It manifests differently.
Okay.
They're often genetic. I already went over that. And hypermobile is the only one that they have not identified the gene yet for. It's a clinical diagnosis. And it accounts for 80% of Ehlers-Danlos types, they think.
Do they only progress from one to the next category, or is it kind of just
I don't have a genetic marker for any of the others.
Okay.
I've been tested. Not everybody with a hypermobile is tested with genetics. I'm going to go through the criteria in a second. But I was confirmed with genetics. They're rerunning my exome now, actually. It takes 3 months to get your genetic results, in case you're curious when they do them. But I'm negative for the others so far, which at this point classifies me into the hypermobile. There's new theories that are coming out in the last 2 years that the hypermobile is more autoimmune driven, so that you have low-lying signs, as you get older. So you have joint issues, exercise intolerance, migraines, weird GI stuff you can't figure out, just mild. And then it kicks off by an event. So a trauma, physical or emotional, viral, or puberty is the thought that you can kick it into hyperdrive when one of those happened, which mine makes sense with the timeline with COVID. Unfortunately, it started kicking off 2019 to 2021. So there's a criteria. It's based on a clinical criteria, so no actual test can get you there yet. If you go online, I actually found out I had hypermobile Ehlers-Danlos and a lot of the other comorbids from TikTok during COVID. Because I don't know if you're even on any algorithm, that once you start looking at certain things, it pushes you related videos, correct? So I have autism, and I was having severe GI issues with my gastroparesis. So when I was getting those videos, looking into it, and it just kept, you watch one and it triggers more, it started adding the Ehlers-Danlos into it because they all go together. And I looked at him like, oh, that sounds familiar. Oh, no. So I had to go formally ask my primary to send me for evaluation because social media is good in some ways and not in others. You'll see a lot of people on social media say, if you're flexible and you can pass the Baton, you have hypermobile Ehlers-Danlos. No, you don't. You pass this step, you go to the next one. This is the first step. 30% of the general population has generalized hypermobility, which means 30% of the population can pass this without having a connective tissue disease. It's basically checking hyperextension in five of the major joints. I score a 6 to 7 depending on the day. Happy to demonstrate. It depends on your age where you're gonna have to score. I'm in the middle where I have to have 5. So I'll show you them. And again, if you're gonna try, don't port it. So the first one is the pinky off the table and flat on the table, up, and it goes more than 90 degrees. Yeah? Okay. I'm not gonna try the thumb one because my wrists are a hot mess. It's joked as the Ehlers-Danlos gang sign. It's all the way back touching your thumb. I used to be able to do it. I can't anymore. Elbows, mine hyperextend past 10 degrees, so it'll go slightly in that way. My knees are the worst most people have ever seen. It says more than 10 degrees, right? Mine are 22. 22. There we are. And then touching the floor, I can, but not very well. I'm tight right now in my back end. I also have weird proportions. So yeah, like I said, some people can just pass that test and just be bendy, but it comes with I can do it on my right. You want me to show you? I'll make you puke.
When I met her at the beach, she literally popped her hip right.
Oh, it still does. I got to go see him Wednesday. Hold on.
But the comment here was, 30% has some generalized hypermobility.
Yeah,
That
yeah.
does not necessarily.
No, it doesn't. No. Like right now, joint hypermobility is different than instability. So like right now, my shoulders don't stay in socket. They need repair. My hip needs a tack. I've collapsed my back. My neck is unstable at the cervical fusion. So that sort of thing. Fun stuff, right? I don't know if I told you my age. How old do you think I am?
24.
Thanks. All the collagen that should be in the rest of my body is in my face. I'm 35.
We paid for that.
No, you don't look 35. So.
Oh, I'm well aware. I still get carded for, I got carded for a light, spray paint or a lighter a couple weeks ago. This is the important part. This is when it gets into system involvement. So when you start having other issues. I'm usually soft or velvety skin. If anybody wants to feel it. My skin is like dough. I have never used lotion in my life, and it is like baby's skin. I'm happy to have you touch my arm. It's also mildly flexible. I can pull my skin off my wrist. So if you want, you can feel.
If you're here to show us, okay.
Yeah, it doesn't feel like normal.
It's soft.
It feels like a.
Oh yeah.
It's not the same as, so when you're trying to place an IV in that, it's not gonna go the same, right? You're gonna have to stretch it and make sure you're in a natural position, because when you don't, it's gonna pull the IV out. Does that make sense? Okay. Yeah. Also, so the skin is there, unexplained stretch marks at weird places with no weight gain or loss. I've got that one. Bilateral papules on the heel. So when I stand, there's bubbles on my heel that are like white pops. They're fat hernias. Because again, tissue's not there. The connective tissue is not there, so I'm getting little fat pops through my heel. Scarring involving at least 2 sites without the formation of one seen in classical EDS. So weird scars. They refer to cigarette paper scars. I have them in a few places. The worst one right now, I have an atrophic anechoid where my port was taken out. So that's a weird one. I'll show you in a minute. Pelvic prolapses for no reason. My bladder is trying to evict itself right now. Dental crowding with high and narrow palate. A lot of people will have braces or palate expanders. They'll take them off and their teeth will go right back to where they were. And they'll do it 2 or 3 times. So that I don't have that, my brother does. That I cannot say that word. Long fingers as one of the following, wrist sign or thumb sign. I do have that. My fingers and hands are abnormally long. The wrist sign I can't do because my body's really swollen right now. And the thumb sign, my thumb goes out on the opposite side, so it's longer than it should be. Just because you have one of these does not,
In tune with their anatomy right now.
not all, just because you have one of these does not mean you have it. You have to have a lot of them.
Thank you, ma'am.
Yeah, so that sort of thing. And then arm span to height ratio is greater than 1.05. The average person, your height and your arms are the same length, right? I'm 5'8", my arms are 6'2". I can reach any tall shelf I want, thank you. And then heart involvement can also be there, and I do not have the heart involvement, thankfully, not yet. I will also say, if I stand next to a really tall person, I don't know who, my dad's 6'4", my hip is the same height as his because of how long my legs are and arms are. I have a very short torso. I don't know if you can tell that from where I am. So you have to hit 5 of those to be diagnosed. And then if you can skip it, you can have family history, and that skips you kind of towards the bottom. And then you have to have chronic pain or joint dislocations with that. And then it's not anything else. Criteria 3 is all else has been excluded. So, rheumatoid arthritis, all that stuff has been taken out. All right, any questions about quick diagnosis? I know you guys aren't diagnosing, but that's kind of like giving you an idea that systems are all involved. Okay, joint instability. One of the big things I'm going to say is we have recurrent, some of us have dislocations and subluxations, and we won't know we hurt in an accident. Normally, I just put them in myself. I don't have to go to the hospital for joint dislocations or subluxes. But if we are, you need to be very careful. We tend to have something called AKI, ACI, axial cervical instability, or cranial cervical instability, which I have mild, we're working on it. The ligament between the base of your skull and C1, C2 isn't connected anymore, or is starting to deteriorate, which means you're at very high risk for neck injury, you start getting neurologic symptoms, and people who are severe can internally decapitate themselves. So please be careful with that. I am not anywhere near that, but that's my range of motion on my neck, is I can touch my neck to my back and then all the way to my chin. We may have chronic changes in our joint, we may brace, and we may have had multiple surgeries on our joints. So yeah, that's where I am. And I have a bunch of demo stuff. If you want me to do it with this section or at the end, just let me know. I can do it either way. Do you guys want to see it when I'm talking about it or like at the end? Do it now. Do it now. Okay. Okay, I'm like, all right. All right, you guys do whatever you want with it, touch it, play with it, whatever. So I brought the weird ones I have. I have to use a lot of adaptive equipment now. I cannot open a soda can anymore without hurting my hands. Yeah, so this is called a pull tab. So it goes on there and you can use it for cat cans and it opens the can for you. So I just can't grab it with my fingers without like pushing it in a weird way. Custom hand orthotics, I'm past the point and where I need, do whatever you want. If you want me to pass them, I can. I have probably 6 or 7 generations of those now because my thumbs were my first joint to go. Shoulder sling or a shoulder brace. I'm getting a new one ordered tomorrow from my ortho. So this was trying to keep my shoulder in. Huh? The Anaconda? Yeah. We were trying. It didn't work the way we hoped it would. And then I almost, at this point, have to use a mobility aid most of the time. Mornings are my best time, which is why I'm okay. Won't be in probably an hour. But my dog is sleeping right now. I'll pull him out in a minute. He's exhausted. My service dog is almost always with me, or I'm using a cane when I'm in public. I have a habit of falling right now for multiple reasons. And I prefer a dog, and I don't like people getting very concerned when they see me fall, because people tend to do that, right? I have my cane is adjusted for my right hand, because a standard cane, my grip will mess up my hands. So this one is fitted just for my right, so you can see it like grips that way, so that I'm not putting weight in the wrong places. On days I'm really wobbly, or post-surgery, I think you met me on my crutches. I have bilateral forearm crutches. I can't use regular crutches because of the way it places pressure on my shoulders. So I didn't pull these all the way up, but they kind of, I'm looking for this. This one's the left. Sorry, it goes like that. I'm like, I need to adjust. I had them collapsed in my car. I shouldn't have done that, but yeah. Yeah, they're, yeah, sorry, I can do it. Just let me find a button. There's that one. Yeah, and they're adjusted for me. They have multi-point adjustments, so they can adjust the angle on the, oh, that's great. I know, I don't use these. There you go. It's right there. See what I hit with the hands? There we go. Where's the button? They've got to figure out a better way. It's one of these. You see what I mean? It's like one of those, like, 2 more. There we go. There's that one. Huh? Him?
He's coming to pick it up, don't help.
Oh, yeah, he knows I'm about to. I know, sir. You can go take your nap. Yeah, so this is kind of how I go. These are a little low. I should have put them up higher, but yeah. Just like that. Yeah. They're lighter weight than you think they would be. But you're welcome to play with them or mess with them. Just don't adjust the angles. So
the importance of why you take your
Yeah.
people's devices, your patient's devices with them, because they're not standard, right?
Yeah.
Like, we go, oh, you could get another one, it's not important, it's really important.
these run about $300, these crutches alone. The cane was $220. The custom orthotics, God help me if insurance didn't cover them, right? So yeah, it ends up really stacking up very, very quickly. So yeah, that's where we are. But yeah, welcome to pass them around to it. Yeah, that's the right height. Sorry, I was like, so yeah, there we are. But yeah, so like, because you can see I can stand like this a lot better than like I would just generally. So like technically right now, huh? Yeah, kickstand. It's like a a little bit of extra support. So because we lose the abdominal muscle as well, unfortunately. So
I can't remember, what is the,
hypermobile Ehlers-Danlos.
say that again?
Hypermobile Ehlers-Danlos syndrome.
Okay, and then what's actually happening? It's like,
It's a connective tissue disease. Yeah, yeah. It affects every part of your body, unfortunately. And then my hip brace from when either it decides not to behave itself or when I have my surgery again. That goes all the way. Which one?
your surgeries, what are they do? They taking stuff from other parts of your body?
They can't. It's bad.
So what
They go in. My hip, the guy who does it is brilliant. He went in. He did my left already. My right needs to be done. My left, he went in, opened the capsule, tightened the capsule, shaved down the bone for the impingement, and then tightened my labrum, resutured my labrum, and closed the capsule. He has to do the same on the right. And then my shoulders both need repair. This one, I have a Hagel lesion, which the humerus is disconnected from my scapula. This one I haven't had imaged because I can't go to surgery right now. So he's going to have to go in, reattach the ligaments, and tighten all the other ligaments up and take down any impingements are there.
You go to VCU or where's your?
No, no, I don't go to VCU. Ortho Virginia is where my orthos are. Most of my care right now is at Duke and Hopkins.
Okay.
Yeah,
So the connective tissue is just prolonged, getting longer, and it doesn't.
it's fragile.
Okay.
It's collagen, so anywhere you have collagen in your body is degrading, and it's just not building back up. So, yeah, the problem is you have an injury, and our ligaments are stretchy to begin with. You get the joint instability, the dislocations and subluxations when it gets stretchy, and then you tear or rupture the ligament. So it's progressive.
Do you have a lot of chronic pain with this?
Yeah, my pain is unmanaged right now. Yeah, I'm on for pain meds. I'm allergic to, or I'm reactive to most opioids. Can't take Toradol due to a kidney injury. NSAIDs and Tylenol are off the table. I'm on ketamine a few times a week, transdermal buprenorphine, and THC. So you don't really get a whole lot of heavy hitters more than that, right? It doesn't for me. I don't have the right receptors, but it helps a little with the nausea. Mobility aids bring them. Ambulatory wheelchair use doesn't mean we're faking. It means that we have it for some other reason other than being paralyzed. Most wheelchair users are not actually unable to walk like at all. Most people can walk at least a few steps. Often with us, it's used for like fatigue, POTS, so heart rate regulation, or pain instability. We just can't do long distances. Mast cell activation syndrome is one you probably haven't heard a whole lot about yet, but it's getting more and more common. So it is an overactivation of the mast cells. Everybody has mast cells. It's what released histamine when you have an allergic reaction, right? Basic anatomy. Ours are overreactive to things it shouldn't be all the time. It's not a true IgE allergy, it's a reactivity. It can be very hit or miss as to what it is one day. So I can have a reaction to an egg one day and be in almost anaphylaxis, and the next day eat egg salad. Like, there's no legitimate reason for it, but some of us have constant triggers. It can be a scent, like a perfume, so really be careful about what you're wearing when you're out. Please don't douse yourselves in cologne, and watch like Febreze in the back of your rigs, please. It can be food, it can be medication, it can be heat, it can be stress, it can be anything. Exercise can set us off. Some people sun, sweat is common. It just, anything can set you off. And then I do want to definitely give a difference, that there's a difference between anaphylaxis and anaphylactic shock. Did you guys know that part, or you think they're the same?
Breathing versus the blood pressure.
Yeah, so your anaphylactic shock's going to have your blood pressure, your heart rate, your respiratory suppression. It's your shock, like shock basis, right? Anaphylaxis simply means involvement of 2 or more organ systems. So GI, skin, respiratory, urinary, neuro. Any 2 of those involved is anaphylaxis and needs to be treated pretty carefully. I get anaphylaxis with every system but respiratory. So when I go and I'm like, hey, I need drugs IV because I can't manage this, and I just EpiPen, they're like, no, you can breathe fine. I'm like, except no, because the last system that gets involved when I have anaphylaxis is neuro. And I've ended up in the stroke unit because I literally look like I have a stroke. Half my face starts melting, I have trouble talking. That's anaphylaxis, unfortunately for me. Normally it starts as, I'll show you in a minute, but we have a very long allergy list. I think I have over 13 documented allergies. EpiPens. So one thing I do want to say, and I'm going to talk about POTS in a second. POTS, a lot of us are on beta blockers as a first-line treatment. So propranolol, enalapril, metoprolol, that sort of thing. Beta blockers make your EpiPens less effective. Do you guys know that part or no? Yeah. So catch-22 on that, right? Because we're already on these drugs, and then it makes your beta blockers less effective. We're also more prone to rebound anaphylaxis. You give us an EpiPen, great. 10 minutes later, we need another one, okay? And then if you're giving Epi, you need to administer in the alternate thighs. I don't know if you do IM or IV, but if you're on the phone with somebody, making sure if they're doing a second one, doing it in the other leg. Why about that drug do you need to do it in the other leg? No. Why won't it be effective in the same leg?
Because they're all separate. Sorry,
Vasoconstriction. You're not going to have the blood flow to absorb that drug. So that's why. Because at that site, you're just not going to have, that's going to be, from there, right? And I'll go over the allergies in a second. And this is my reactions. The middle one is the first time I showed up to my new allergist at Duke. She loved me for that one. And then the first one, I don't remember what time. They were about 4 minutes apart from the first to the picture on the end. And I EpiPenned myself a few minutes after that last picture. Because you can see the swelling and the redness was going pretty quick. And I wasn't able to help myself at that point. So my reactions start as pinpoint hives and flushing, normally on the left side of my face. GI symptoms get worse. I get swollen, I get pain, and I get stroke-like symptoms. And oddly enough, one of the drugs I cannot have is Benadryl because it causes horrible heart issues for me. POTS. So this is one you guys are seeing a lot, I heard that you're seeing a lot more of. And that the population you're seeing it in is in the college areas, correct? A lot of women. Post-viral, puberty, stress. You hit all the things that kind of trigger that, right? The technical diagnosis is a sustained increase in heart rate of greater than 30 beats per minute with standing, or it hits over 120. If we are having a POTS episode, most of us do not call 911 for fainting, please. If I'm out more than 2 minutes, feel free. If I'm just down for a second or two and I can fix it, don't call 911. If somebody's having that, put our feet up because it's due to blood pooling usually. So you're gonna wanna put our feet up, get the blood towards the abdomen and the brain, right? Calm. It's a neurologic disorder, not a cardiac disorder. That's the common misconception, is everybody thinks it's a heart problem. It is not a heart problem. It is a failure of the autonomic neurosystem, so your rest digest system. So when you're in overdrive and you're having a POTS attack and you add stress and you add everything, it becomes a little bit of a problem, so calm. Resetting the vagal nerve, so ice on the neck and the groin and the axillary areas can also help. Not everyone with POTS actually faints. Some people have other symptoms. Some people get to pre-syncope. Not everybody loses consciousness. It can be triggered by exercise, heat, eating, especially high-carb meals, stress, position, showering. Mast cell can make it worse. And then the first-line treatments are salt, fluids, and beta blockers, and then there's other meds after that. Any questions on the basics of POTS or anything? No. That's my heart rate in one day, 65 to 140. And this is over, I think that's 6 months. I go from, this is like my daily heart rate before meds. And I do go into SVT on a decent, regular basis. I just don't care enough to do anything about it. GI manifestations is what I'm struggling with right now the most. Motility issues are very common, so the paralysis and non-movement of the food and everything. We're prone to dehydration, nutritional deficiencies, and hypoglycemia. And then those are the other conditions, GERD, intestinal dysmotility, compressions, and IBD also get commonly diagnosed. This is my radioactive egg challenge. To get diagnosed with a paralyzed stomach, you get to eat 6 to 8 ounces of water, 2 pieces of toast, and they gave me jelly this time, thankfully, and a radioactive egg. And then you sit in every couple hours, or every hour, they take a picture of your stomach to see if the egg is moving. Less than 10% is normal in the normal population. Mine had 33% at 4 hours. So, and that was a good day. And then this is my at-home. I had a feeding tube this fall, and that's what I was managing at home with my feeding tube at night. Oh, I don't know if I did vascular compression. Vascular compression, sorry. I'm just going to do this real briefly because it's not as common, but it gets missed. It's actually almost always diagnosed as a psych issue for years, or it's found on post-mortem exam. Okay? I have one called median arcuate ligament syndrome, which means the celiac artery and celiac plexus are constricted by the median arcuate ligament every time I eat, which causes extreme pain in my abdomen. Extreme pain, as well as other GI systems. So my gut's not getting blood flow. Mine's greater than 70% stenosis. I'm waiting on a surgical plan for that. And then the other one is nutcracker, where my left portal vein is constricted between my aorta and my kidney, causing some issues, but we're not dealing with that right now. All right, this one's a fun one. Central lines, feeding tubes, all that stuff, right? This one I'm gonna demo, but give me a second. Make sure I have my hand sanitizer. So feeding tubes, you need to ask about position and type of tube. A lot of time the feeding tube is more positional information than it is like the actual physical tube. So an NG is nasogastric. You guys know what those two are, right? NG, NJ. It depends on where it is in the body, and the use of it is very dependent. PEG, GJ, and G tubes are all surgical tubes. Ask what type. The anatomy is important, and then what formula we're on needs to. If you can ask that question, that's great, because a lot of us are on hypoallergenic formula due to the mast cell. If they're exclusively tube fed. They can be used for feed fluids and medications through that tube. Central lines, again, PIC, Ports, Hickmans, can have for multiple issues. The risk for sepsis and blood clots is high. I'm going to say this very importantly. You need consent from the patient to touch a central line of their own. A lot of us will not let people touch it, other than our home nurse or ourselves. I've had issues where a nurse was not using it appropriately, and I literally took it out of her hands and said, I will be taking care of that, do not touch it. Because what she was doing was extremely dangerous. You have to remember, a central line is my lifeline. You don't get those for no reason. That's for fluids, that's for medication, that's for food, and my risk of sepsis is so freaking high, I don't want to go through that. So be aware that if I have one, you need to ask if you can use it if you have another option. A lot of times we have poor vasculature. Again, connective tissue, right? It's in your blood vessels, right? Stretchy blood vessels. You get to blow veins real easily, right? You also, we scar weird, so every time you're poking a vein, you're leaving a scar, okay? So if you cannot get an IV after 1 or 2 attempts and you can wait, please don't, because when you hit that vein and you cause a hematoma, you now have a scar in that vein, right? Now that vein's not usable if we're in the hospital, or if it scars weird and now that vein's completely unusable. So you've just taken away more access for the nurses, right? So I have very little vasculature left. So what I was going to show you is, can you guys tell I have a central line right now? It's on my arm. I have a PIC line. Let me find my hand sanitizer. So I was going to show you, I'm trying to find my hands. There it is. All right. If you're touching it, hands need to be very, go ahead, go. You're fine. I know why you're here. I'm aware. Go, you're fine. I'll sit down. Go. I will sit down. You'll be fine. I know. I'll sit down. So I'll show you. So I am on TPN daily. I eat very little by mouth, cannot maintain my hydration or my nutritional intake. It got bad. So this bad's not good anymore. But this is what I'm on nightly for 14 hours. Custom made for me weekly based on my lab results. And it comes as a clear bag or with lipids, and then I inject V vitamins into it. So it's heavy. You're welcome to pass it around. It's trash after today, but it has my custom formula on it. Like I said, it's heavy. And then I use a backpack to get myself around, just because I'm more mobile than a lot of people, and I hate IV poles. So like if you came to my house at night, I would be hooked up to that via a backpack. Like it's actively hooked up. So just, watch that. I've had to be taken when it was hooked. So, and then I pre-automate everything at my house because of the number of emergencies I've had and people have to help me. So I have like a TPN start kit. So when my shipment comes in on Friday, I just put it in individual boxes and I can grab it. And keeping in mind that it is a sterile site, okay? Once that bandage comes off, it is completely sterile because of the risk of infection. So I have to have my dressing changed weekly by my home health because I can't do it. But magic, never knew I had it, right? So have you guys handled them or seen patients handle them themselves, or PICC line's kind of new to you guys?
No, we don't normally know.
Okay, yeah. Do you want me to show you how I use it daily, just so you know like my comfort level and you can trust your patient on it? Okay. And then if you see in our house, like she brought up a good point yesterday, if you went in my house, you would know I'm a complex patient. I have a Craftsman, is it in the next slide? Full of medical supplies because of the amount of stuff I have. Yeah, that's my setup. I literally have a Craftsman full of it. So you would get a lot of information just by looking at that. So I keep mine covered because I don't need every nosy Nelly at Walmart asking why I have a central line. Also infection risk. So it's covered by a green cap, which is antibacterial. Always cap it if you can, okay? Make sure your hands are very clean. If they're dirty, it's just gonna spread it. So anytime in between any injection, when you start anything like that, it is a full 15-second scrub on a central line. Full 15 seconds, not a wipe and go. It is 15 seconds of scrubbing around the screw cap, all the way down and into the valve area, a little bit of pressure. Because this line goes literally from my arm right before my left ventricle. You are injecting bacteria directly into my heart if you're not careful. Okay, so I HEP block mine, and again, once you do it, you don't touch it, and then air, unclamp. Mine has an extension because I do this myself. The technical length is only that long. Also, it will have a time or a date and an initial on the last time the dressing was changed. Most of them will. So it needs to be changed weekly at least. So, any questions? Because I'm talking to myself a lot. Anything? Yeah, so. Yeah, once a week, and she draws my labs because they can be drawn. Oh, I didn't even show you that. So I'll go back and do that. Yeah, I'm gonna go that in a second, yeah. So you can always, sorry, I didn't show you this. You can always, if you're concerned about placement on a central line, you can pull back and you'll get blood. That's how fast it's going. It's a large bore. This is large bore. I don't eat enough by mouth to sustain myself, and I failed a feeding tube. So I live off that bag you just passed around. That's how I eat. It's not long term, it's life support. I'm running out of time.
She's what you would call right now on palliative care.
Yeah,
Keep her comfortable and alive daily.
So, is it a function thing that's stopping you from eating?
I have a paralyzed stomach and a vascular compression. So my stomach is excruciatingly painful to eat every time I do. It feels like a burning knife under my ribs. And it doesn't empty any reasonable time.
Road manifestos.
Yeah, the nerves are damaged. My intestines and esophagus are as well. I'm not absorbing. We're working on getting me surgery. I have a surgery on June 26th for the gastroparesis to, it's called a G-poem, where they go in and it's similar to pyloroplasty. So your pylorus is the bottom of your stomach, right? They're going in and cutting my pylorus a little bit so it empties a little better because I've failed all medication for it. And then my vascular compression, I'm trying to get planned out, but the surgeon is moving to Missouri. So I gotta wait until he's settled there and then go to Missouri for that. But yeah, so I am lucky that I also have the ability to run fluids at home if I'm extra dehydrated. So I can do that if needed. And my TPN's on a pump at home that's set by the infusion company. But yeah, that bag you passed around, this is about $1,500 a day. So don't lose it. Don't throw those away. Huh?
We won't complain about food taxes.
Yeah, everybody's like, oh, it must be cheaper for you to eat. Like, it must be so, you don't eat that much. It must be, no, this adds up very quickly.
$1,500 a day and that one's expired?
Yeah, it's not, I had an issue with it. Huh?
I've eaten expired food now, right?
I know, right? It's like, God, my insurance, like me. So far this year, they've paid about $600,000. My insurance this far has paid $600,000 for me.
When did you start to experience the symptoms in your life?
2019, well, I started young. Like as a kid, my knees would slip in and out. I had migraines way too young, GI issues, that sort of thing. I had my first back injury at 21, I think, second at 22 or 23. My thumbs started going in 2018, 2019, gastroparesis at 2020, and then 2021, 2022, it just snowballed.
Okay.
Within the last 18 months, it's gotten really bad,
Right.
really bad.
What is this, like, as a child?
There was weirdness, and my mom also has it. My brother probably as well. Like my brother had a colostomy when he was a neonate because they perforated his intestines with an enema. So, and it scarred horribly. So, it was reversed and everything, but that doesn't happen to normal babies in general, I don't think. So that's what happened. So, I do want to say most of us are ADHD or autistic, which is, again, neurologic, right? They have communication issues during a crisis. I talked about this yesterday. If there's multiple people involved or it's something like that, having one person giving very clear instructions, not 4 people telling me to move this way, step this way, everything like that, that gets very overwhelming and very confusing. Clear instructions from one person. We're not stupid. I can understand what you're saying. You don't need to talk down to me in a baby tone, but my brain is going a million miles a minute. I'm probably painful, I'm probably panicky, and something else. So just slow, calm. We have increased sensory and communication needs. I cannot tell you the number of times I've been in the back of an ambulance, transported like long distances with the lights in my eyes. Like, please, if you don't need to be doing something actively on that hour ride, please dim those lights. Quiet and calm. Be very clear and patient when giving directions, and we may be inconsolable. So I get very anxious and emotional when I'm dealing with medical situations, and one of my pain signals is that I will be on an emotional roller coaster. So I will look bubbly and happy, and then I'll be crying and can't get myself up. I also have a habit of going trouble with nonverbal communication. If I'm a 10 out of 10 pain, you can't wake me up. There's no hope of getting me up. You can get me up for a minute to maybe arouse me, but I'm not waking up. And a lot of people see that as a sign of comfort, that I can sleep. It's my neurologic system going, screw you, you're done. You can't live through this. So that's where we are. Stimming, so I'll often have headphones in at the hospital, or when EMS is like when I'm trying to calm down. Gaming is common. Phone use, scrolling social media, it's not always a sign of comfort. It can be a sign of trying to regulate ourselves and distract, and fidgeting, or just fidgety. So our pain signs are not that crying, upset, I can tell you where it hurts. A pain scale is useless because I don't know where I'm in pain every day. Like, I hurt, I couldn't tell you where I hurt, but I can tell you I hurt. And then our reactions can seem over-exaggerated. Again, we're autistic. Our brain isn't working the same way. A lot of people with Ehlers-Danlos are originally diagnosed with psychiatric conditions. A lot of people with the GI are locked in eating disorder wards because we just stop eating. I was told I should lose weight. I was told I was anxious and depressed. I was told I had an eating disorder. I was misdiagnosed as hypothyroid and took meds for 12 years. Like I said, we die from this disease or have horrible quality of life because people don't listen. Okay? Teddy is over here. He's exhausted. He's 18 months. Don't separate. If you are something happens, try not to separate us. Ask if there's a secondary handler in case of an emergency. You guys, the other group yesterday had a great suggestion for me to put it on my ID. Mine is my mother and a friend. He can go to the hospital and in an ambulance. That is not a restricted area. If a nurse tells you he can't be in the ER, they're full of crap, okay? They can't be in a sterile environment. They can't be in procedure rooms, so like IR or surgery, burn units or ICU. Those are where they're not allowed, okay? If they're in the hospital, they need to have somebody else letting the animal out and helping care for it. The hospital staff is not responsible for that dog going to the bathroom, okay? So you can't ask the CNAs and nurses. Some of them will on their break, but it's not their job to be doing that. You can use a pet service or a friend. He may or may not be vested. In my car, he's often not vested. I do have a sticker on my car. You saw it yesterday where service dog, don't separate. It's just like on the window, he's normally there. In public, they are not required to be vested, caped, or leashed. I can have him completely in Walmart without anything on him. That's legal. And there's a very big difference between ESA and a task-trained service dog. ESAs are housing protection is what it is. You can't be kicked out for having a pet. Service dogs have public access. And then that's he's bracing balance because I have a tendency again to fall over. Medic alert to tachycardia, hypoglycemia. He's not as good about, that was one we didn't know if he's done it. It's not as bad with the TPN, but he's also started alerting to the dystonia on my right side, getting me in and out of places when I'm either anxious or having an issue. He has his own Instagram because I got tired of texting everybody individually. So if you want to see our adventures, it is public. It is Teddy 2_tries. And then I have a few stories to tell. With my mast cell, I have had EMS show up to my house when I was unable to safely drive myself to the ER, and meds were no longer working at home. Show up to my house and ask if I had the flu, and sure I wasn't have the flu. Pretty sure I wouldn't be calling EMS if I had nope, it hit, I know, thank you. I don't have the flu, thank you. And the whole ride there, he was questioning me. 20-minute ride. And then this one, I want to say I am in the position I am because of medical negligence and not being listened to for over 10 years. I am fighting the clock to live. I may not survive this in the next year. I may die because doctors did not listen to me. That's my reality. I have doctors saying I am beating the clock right now. I should not be alive. I look great in person, I look crappy on paper. So just be aware, how you treat a patient matters. I was admitted into VCU this fall. I had a feeding tube, an NJ tube for 2 weeks, did great, up to rate within 2 days, and within 36 hours, it failed. I was unable to tolerate feeds at all. I was admitted for 24 days. They couldn't get the feeds restarted with formula tries, eventually had the tube pulled, couldn't transfer me another level 1 trauma center. Anyone up and down the East Coast, the procedures I need and the doctors I needed were not there. I ended up being discharged without nutrition for over a month to hospice, AMA, to die. That's the reality I'm in. Okay? I'm not sad about it, but I'm going to use my time to do things for it, okay? In February, I had an incident. I had my port placed end of January, and I was doing decently well. And then one day, something bad happened. Tuesday night, I was feeling real off, and it was more than my POTS. I was starting to run a little bit of a fever up to 100, which you guys don't consider a fever, but that's not normal for me. My heart rate was way too high for me laying down, and I was getting odd signs, and I had a port. And anytime that happens, any fever with a port, they tell you to go to the ER. There is no question. You go, okay? Because it's life-threatening. That first visit, it was reasonable. She said, maybe viral, maybe POTS. All right, here's fluids, and I did a little bit better. Next morning, my fever was over 103. My heart rate was over 120. I was tapped to tachypnic, and I was excruciatingly painful. I had sepsis. At that point, it was sepsis or SIRS. SIRS is, I don't know if you know that one, systemic inflammatory response syndrome. Do you know what that is? Your whole body is on fire. Your whole body is swollen and inflamed. Everything in your body, every single thing, your vessels, everything is angry. I had SIRS. It is that was the most pain I have ever been in my life, and I can tell you I've had chronic pain. That second day, my mom drove me to Riverside. They didn't know what was wrong. They're like, something's wrong. My heart rate was over 140. Temperature was like 103.4. I was starting to get hypoglycemic. I was starting to get really odd, whatever. They're like, we need to rule out sepsis and everything else. My blood work at that point was not that awful. My viral panel came back normal, gave me 2 doses of the hardest hitting antibiotics you can have, vancomycin and Zosyn, 2 or 3 liters of fluid, IV Tylenol, and I'm like, we don't know what this is. You're a little bit better. Go home. Okay. I stayed at home for 2 days because I'm not a fan of the medical system. Friday, my temp was down to 99, all right. But within half an hour, it went up to 104.5, and I had the exact same symptoms, the pain, and just not right. And I was driving when that happened. I had to go home. My mom saw me, and the amount of pain and how unstable I was at that point, she wouldn't drive me the 30 minutes to the ER, the 20, 30 minutes. She called EMS, okay? EMS came to my house. I will say the female was nice. I will say the male was an asshat, okay? My heart rate standing was over 150, again, weak, painful, everything there. I have an elevator up and down to my house for groceries and days I can't get up the stairs, okay? He insisted I walk down the stairs to the rig. I could have easily been chaired down, helped down, anything like that could have been done. He insisted that. The female was in the back, that was great. We get to the hospital. The nurses, I know I'm a frequent flyer, but every time I call my doctors, like, go to the ER because my symptoms are so quickly life-threatening. And I get there and the nurses dismiss me because they see my name. And his response, and they told me to put me in a wheelchair and dump me in triage. His response is, this isn't Kingdom Inn, it's not a free ride, move.
Has he ever been to King's Dominion? Because it ain't free.
I don't know, but at that point, I knew what was gonna happen at that hospital. When you hear the nurses trash talking you and dismissing you, and you hear your paramedics saying that, you know what's gonna happen, right? My dad has ALS. That's progressing quickly. My mom can't just dump and go. She has to settle him and then help me, and she can't clone herself right now. So she settled him, got there half an hour. I was in triage. The nurse who triaged me, again, it's the POTS with COVID. No, it's not. I wouldn't be here with a 104, this is not me, and dismissed me. My mom comes in, and the treatment I was getting, she had them remove the IV, and I left. She drove me the hour and a half to St. Mary's, okay? When I got to St. Mary's, I was septic alert, okay? Oh, my cards are in my bag. Oh, I have the values on the back of the cards. My value up on that right corner, it tells you what your normals are. I think it's up to 0.5. Over 0.5, it's concerned for sepsis, right? I don't know where I put my bag. Over 0.5 is concerned for sepsis. Mine was 10.4 when I was admitted. That's a little high. I have the values on the back of it, but there it is, sorry, my bag. But that's what I was. And I was hypoglycemic. My values had all shifted within just, a day or so. I was there for a week, discharged on a Friday afternoon, readmitted on Saturday when I went to the ER because I was not right again, and I had a kidney injury. I have chronic kidney issues now because of what happened. And I was admitted for 3 days, and they got it dealt with and everything like that and cleared by nephrology. That's my tree of life when I was admitted for over a week. It's got multiple doses of antibiotics, fluids, dextrose, TPN. My nurses love me, right? I had to have my mom write this down, so I have the whole sepsis story because I don't remember the first couple days I was there. No memory of it. So the day I was admitted symptoms were there: low glucose, increasing white cell, high fever, tachycardic, low blood pressure, looked like a POTS flare. I was trembling and I had a rash. That should alert everybody that there's a big problem. I also had a central line. Like, it's there. That day after I was admitted, I was in continuous SVT with a heart rate between 150 and 180. They couldn't break. And I was disoriented. I was covered in ice, over 4 to 6 ice packs all day. And my temp was still over 104 with intervention with fluids and ice. They gave me ice, fluids, Tylenol, Toradol, and antibiotics. I was like that for a day and a half, not awake. Cultures were abnormal. They never found out what bacteria. It's something odd. Infectious disease still doesn't know. But the doctor who saw me that Saturday was the same one who had originally saw me with the viral, the one that was, reasonable. And her response was, when she saw me, she's like, I'm admitting you. There are bounce back rules. I don't care what happens. You're going back to St. Mary's. That first decision, that was stupid on my part. Like, she admitted she made it. Like, she's like, that was dumb on my part. Like, that was absolutely, nope, you're going. And then she gets my blood work back and she's like, well, you're definitely going now. Like, there's no question. So my values when I was admitted on 2.6, my heart rate with EKG when I was laying down for some period of time was 122. I can hand this around. Potassium was 3.1, normal is 3.5 to 5.1. My ALT was 76, up to 35 is normal. My INR, which is a blood clotting time, I think, was borderline at 1.1. 1.1 is the end of normal. My protein was 11.3, which is a tiny bit over normal. My AST was 66, 35 is end of normal. My total proteins also tanked, 5.0. Bottom normal is 6.4. Right? Admit 214, Valentine's Day. My BUN had gone up to 35, end of normal is 20. My creatinine, I was in stage 2 kidney disease, or kidney failure. 2.67, up to 1 is normal. And my EFGR, which is your basic value of managing kidney over my age, should be 90, it was 23. So, yeah, that's kind of what happened. It wasn't my best time. They were worried about me. And then I have a bunch of demo stuff, which is the fun stuff. Any questions about the basics or like that sort of thing? Because, again, I don't like talking to myself.
You said you have a hypoglycemia issue. What's that tied into exactly?
My stomach not emptying consistently and eating consistently. My stomach has a tendency of holding things for 8-12 hours and then dumping it. So there's nothing absorbing during that time. And I wasn't eating consistently for months. My hypoglycemia has been managed when I'm on TPN and when I was on tube feeds. So it's a nutritional deficiency issue. I will probably always have a central line of some sort, at least for fluids. We're hoping to get me off TPN within the next year, if I can. And I'm gonna go over allergies and like the stuff I have. But ironically, the newest reaction I'm having is the plastic to the bag. Every night I'm having a mast cell reaction to the plastic that it's made up of. So.
Is there an alternative to that?
Not right now. We're trying to figure it out. Glass for the fluids, changing the lines to hypoallergenic, but there's not a whole lot. I've had 3 central lines since January. I'm on my 3rd right now, which is not ideal. But obviously my port was taken out when they were concerned for sepsis. So that's what I got now is a giant freaking scar and it's getting bigger. So, all right, I got the fun stuff now. I'm looking at what I got. So with my central line, I also use accessories that help me out keeping it clean and so I don't trip myself on my massive leash. When I'm on it, I have a 2B clip, which is generally on my shirt or my pants somewhere, which I wrap the fluid line around so I don't have a 6-foot leash I'm gonna fall over in the night. If I'm in the hospital or somewhere that's high risk for infection, I'll cover the connection between my IV line and my port with one of these so it doesn't get as much, and then pick sleeves, obviously, to keep myself clean and covered. Things I have, the My ID is definitely something we gotta go over. A lot of you also probably haven't seen Avacue EpiPens. I have not seen a paramedic or a nurse know what these are yet. And I have some expired ones to play with, and then I'll show you this is what I have in my bag. Like my backpack, I always have 2, okay? It's in the outside pocket. I also always have my emergency meds with me. Mine are labeled because I don't think anybody should have to figure this out. But I have my emergency meds in my case at all times with the dosing and the medication on it. So that's there. And then I have expired stuff, Avicus and oranges if you want to try them, and I'll show you the demo real quick. And then I have regular EpiPens for your basic class to leave. But so anybody want to poke an orange or whatever? There's one.
How does the emergency meds?
Those I carry with me. I have 4 of them, so whatever you guys want.
Not something.
No, but you may want to grab it to know that I have meds. There's one more. You guys never seen these before? I'll tell you why I have it in a minute. Tedford, you're fine. I know. Why wouldn't somebody give me an EpiPen? These are extras for your basic.
Oh, thank you.
It has the trainer and then the basic, those are all expired. So the reason I have that is 2. One is I get the stroke-like symptoms, right? I can't talk. I can't walk somebody how to give an EpiPen. And then the studies show, like both with CPR and EpiPens, people don't administer them because they don't think they can do it correctly, right? You have a good bystander, they don't feel comfortable taking that giant pen and throwing it against my leg as hard as it has to go. That's a lot safer alternative for me to hand to somebody when I can't have effective communication and be like, help me, like that sort of thing. They're often used for nonverbal autistic children or people like me who have issues communicating. Yep. But again, you guys know the rule that if you have an EpiPen, you take it to the ER with you to make sure it was deployed correctly. Yeah.
Yes. The black end.
Yep. Yep. Did you take it off? The green, the red, the orange is off of it. Okay.
Except that it has the black part been pushed back in because it's already been deployed.
Yeah, that one is that one used.
Yeah,
Sorry about that.
No, that's fine.
No, it's not. Oh, it might be. Sorry.
No, you're fine.
I tried to separate them out. Sorry about that. Somebody used it yesterday.
You want to use this one?
Sorry. I'm sorry. I'm sorry. These are like $2,000 a prescription, so they don't get them as often. I can only get them when they re-expire because they count how many EpiPens you use.
That was so cool. Oh, that was the last use too.
Well, they're single use. I would expect them to be single use, right? And then he and I have a story. Do you want to tell him? You tell him, not me. If you want me to toss them, I'll shove them in my Sharps container at home.
I've never seen that.
Nope, that's fine.
I've never seen that either.
Yep, I got it. I got it. I'm good at it. It goes this way. It should go. What? I messed this up. I don't know. Sorry. There it goes. I don't know if it'll go back in at this point.
Yeah, you got it.
It might not.
I was able to
There it
get
goes. It clicks in. I'm not going to do that though. I'm not going to stab myself.
So you just pull the red cap off.
Yeah, it's like a regular EpiPen. Like, you know, it talks you through how to do it. Can I have the demo? There's a black one over here, if you didn't get to use it, that has it's a demo one from the pharmacy that you can mess with. Sorry.
So, a couple years ago, probably more than a couple years ago.
2022, I think.
Yeah. When I was working part-time at West Point, she was actually heading to work and pulled over right there on 14 in the parking lot. And we got pretty much a 911 open line, unknown medical. And we go out there, we're looking, and there's not many cars on the road at that point. It's like
5:30, yeah.
But we couldn't find her, and she was actually sitting outside of her vehicle, like curled up inside of her vehicle, unable to talk, unable to communicate. She had her other dog with her, and we show up, we're not
Thank
able
you.
to communicate.
Appreciate it.
We were able to get in touch with their parents, who were actually already
Yeah, I
on
got
the
it.
way.
It's fine. I'll toss it in my Sharps. You're good.
They were able to
Thanks.
give us everything, because she didn't have all this stuff yet. She was still going through it all, but it was definitely interesting, because, I mean, it was last year you came and talked,
Mm-hmm.
and that's when we found out, like, hey, that was the interaction we had. Like, I remembered that talk, and she, remembered it as well, and we, so there is a chance that even though these people don't live in your first two, they may run into it in this job community. And now technology has become a whole lot better to where, like, she has.
I'm gonna show. Yeah, I was gonna show.
She's gonna show you. So it may look just like a regular watch, but flip it over, look at it. It may have some type of medical ID on it. But we, at the time, we didn't know. Like, we never transported a dog with us. We never. I mean, it's West Point. We're just a couple guys that are just working there, hanging out. So we called. The parents came, got the dog, followed us to the hospital, and then from there, I guess everything that's transpired since then is now transpired, and now she's still here, and we get to talk about it.
Despite everything.
Yeah.
All right. Who's got their? I mean, you all have your phone on you, I'm sure. Grab your phones. Yep.
That's all.
Yep.
Did you turn off the notification?
Yeah, I'll turn. I kept them off from yesterday. I'll get the one to me and I'll show you. But yeah. So I wear not only a regular ID that's silicone because I can't have metal that has my basics on it, and I'll pass. I have an extra one of those I can pass around. Here. This is what my basic has. I wear 2 medical IDs. So that's my basic one. You need to be looking for things other than the silver bracelet. Not everybody can wear silver or metal without irritation. And then next to it, I wear silicone, or on my watch, I have this. It has the medic symbol on it. It's very clearly, if you're looking, it's worn in the typical place. You gotta check it. So grab your phone, flip it over, scan the QR, and I'll show you what happens. I have 3 of them. I just need that back.
Interaction with EMS before you try to explain some of the stuff too. How was the reaction from them? Terrible?
I don't go to the hospital anymore. I have told my mom there's days I'd rather die at home because of the amount of horrible care I've received.
I mean, think about how we run some of our frequent flyers. We're like, hey, come on. Yeah. Get in the truck, let's go. We're running down the hospital.
But, well, and then think about PTSD. How do you fix PTSD for somebody with therapy, for somebody who's military or in a domestic violence situation? What has to happen for them to finish and complete therapy? Like, how does that, know how that works? You have to be taken out of that situation. You can't continuously be in a domestic violence situation, heal from PTSD. You can't be an active soldier with PTSD, right? They pull you for that. Somebody with medical trauma who's medically complex, I don't have the luxury of escaping that. So if you look at that, it has all my allergies, my essential medical conditions. It has my emergency contacts. It has all the medications I'm on. There are notes under those medications. And unfortunately, if you look in my documents, it also has a copy of my DNR. So you don't need to ask for that. You can honor my DNR with that bracelet. There's no question. Oh, did you need it? Sorry, I can grab you one. Yeah. But also, when you scan it, it sends a notification to my parents and my other emergency contact. I'm gonna pull it up. It didn't pop up. There it is. Go under documents. There should be a post form in there. But when you just scanned it, it went to me and my parents with my GPS coordinates. Wow. So you see a call come through my cell phone. Yep. So if you scan it and you suddenly see my cell phone light up with Mom, you may want to pick that up to tell her that, shit, something bad happened. So it has all my GPS coordinates on Google Maps as soon as I'm scanned, and it's sent automatically to my family. I know the percents behind a DNR of the less than 15% survival, and then mine are even lower. So it's not an unreasonable decision for me. And I've had doctors who won't recognize I have a DNR.
They won't recognize it?
I have doctors who said I cannot, I've been admitted to the hospital and tried to change my mind, that it's not accurate, that it's my choice, so. Thank you, I appreciate it. Yep, that one's my everyday one, yep.
They got a call.
I know, I got it, I heard it.
Thank you very much.
You're welcome, have a good one. And then I have the service dog stuff. Oh, binder. A lot of us will have one of these that's easy to grab, so if you have the family, normally they know where it is. This has everything you could possibly need in it. It has the same stuff on the bracelet in a printed form. Sorry, were you waving? Oh, yeah. So you have the same thing on a printed, that's printed, so you can hand this directly to the nurses. Has information on my rare conditions, has the letters from my doctors, for my allergy protocol, my service dog, and all that stuff in it. So you're welcome to open this and see how I have it organized with my horrible sense of humor, but it's very easy to see, and it has my post form in it as well.
The nutcracker phenomenon, is that still the HEDS?
All of it comes from Ehlers Danlos. All of it stems off of it. That's the one that is between my kidney. That's the kidney compression. So once you start getting compressions, you keep getting more, unfortunately. And then my EpiPens are stored in one of these in my bag. I don't know what else I have. And then his service dog gear, extra stuff is here. And he has different ones depending on my needs that day. So like this is the one he had on yesterday because I wasn't as wobbly. And then I have, he doesn't have to be leashed, but he has biothane leashes. And then if it's a quick in and out, he might just have one that says that, or a regular leash. So, but yeah. Any questions? Because again, I don't know what to tell you. Thank you. All right.
This is very organized.
Yeah, they keep trying to kill me.
You would be a great patient.
Not most think that. But yeah. But yeah, it's a lot easier to hand that to a nurse when you get there, right? Than to have to communicate over the thing. Oh, I have another EMS story. Another one. This one is actually the ER's fault, not yours, but it was a communication issue over the radio. I got taken to Riverside, again, by ambulance. Shocker, it's the same hospital most of the times, right? I go there because I was found on the floor by my neighbor. That's not normal. Not normal to be tachycardic on the floor by your neighbor. She called, not me. And they communicate everything over the phone. She has gastroparesis, POTS, MCAS, hypermobile Ehlers Danlos. It wasn't as bad then. I get to the ER again, dump me in the lobby. Cool. I get taken back into triage. And hey, guess what? You know, she's like, how much did you eat? What? How much did you eat? What are you talking about? How much THC did you consume? It's POTS, not pot toxicity. And then they take my vitals and they're like, oh shit, let me get her to the back. Like, move real quick after that one. Like, you don't, like, it's bad.
I feel like that's not even something.
They didn't know what POTS was at the time. It was years ago. They had no idea what it meant. So guess who got a call with some articles sent to them? Sorry, I'm not.
Training for everyone.
When you file a complaint and be like, you didn't know what this was, like, you gotta deal with that type thing.
So pain management from like EMS standpoint.
Oh yeah, buprenorphine.
Ketamine and
You can't. I would ask what I'm on. I wouldn't admit. For most people, you can administer something. My ketamine, my buprenorphine, if you don't know much about it, it's like a lower level opioid that's continuous absorption. It's literally right there. That it has a higher affinity for the mu receptors in your body to cover them, which is why it's used as like an addiction medication a lot of the times. So the dose adjustment for fentanyl is higher. You actually have to give more fentanyl to kick the buprenorphine off of those receptors. So I wouldn't mess with it because you're not with your standard dose. I mean, you can try, but you're gonna have a harder time getting those receptors to do that.
So look at her patch on her left arm. Because it doesn't say fentanyl, it doesn't.
It does under it, but yeah.
It doesn't, right, but if
Yeah.
you're not looking, it's a tattoo. You see why that assessment, primary and secondary, is so important? That's your secondary assessment and you missed it. Because even the port on the other side, right? So,
And that's a little more, half the time that's slipping off.
now when we say secondary assessment, if you didn't look, you don't know how to make the right decision at the right time. And when in doubt, you can call a friend, right? But you gotta find it to call the friend to ask the question.
Do hospitals generally know that's already a patch?
They
might
should.
not know either. They have to.
That would pick up because of the pharmacy registry, because it would pick up as a flag
Good point.
for the DEA. So they should pick that up when they pull my name up. And most of the hospital systems have a somewhat current med list on me because of, I'm in the most of them. My primary, because of the shitty care I've received in Virginia, my area and Richmond has recommended that anytime I can safely get to out of state to Hopkins or Duke, that's my best ER.
That's insane.
Yep, 3 hours to figure out, go to an ER. Because of the amount of times of errors and dismissal and the situation I've been in. No, you're good. That's the level we're at, so, sorry.
But also think about this, when you transfer a patient to the ER and you've gathered all this information, you get your report, right? And she mentioned multiple times, they said put her in triage, take her to a waiting room, whatever. Know that at that moment, you are the patient advocate, right? And I think I was with Heath the other night, and they said, this patient needs to go to the waiting room. And I said, we'll wait right here until you can get a room. And they were like, well, they can go to the waiting room.
Ted.
I am not putting the patient in the waiting room. I will wait until you have a bed. Because at that point, right, I felt like the patient shouldn't have been put in the waiting room. So,
I've had a couple EMTs that were uncomfortable as well
right.
doing that.
And so, like, this is, luckily my captain's here. If I was to call him and say, I'm gonna stand here for an hour until they give me a bed because I don't feel like I can put the patient in the waiting room, I know that he's gonna support me. So you can also have that conversation, you know, with your officers or whatever to say, like, hey, this is my patient, this is what I have going on. I'm not comfortable putting the patient in the waiting room. We're gonna wait. Oh, it was the car accident lady that we had the other night. Her leg, I could see her bone. She had a laceration. And they were like, put her in the waiting room.
What?
And I said, absolutely not.
Where?
She also didn't speak English.
Where was it you?
Centera.
Yeah, I mean,
You wanna be level 3 trauma center, I'm just
But
saying.
my point is, in all this,
Fair.
When you have patient care, you are supposed to give it to a higher level. A waiting room is not a higher level of care. So if you have to take that 5 minutes, 10 minutes, 50 minutes and stand there and you're advocating, I don't think that this person should be sitting outside by themselves, then that's what you
Teddy, sit down.
And it doesn't happen often, right? Once every couple months.
Ted,
They
go
say
lay
put
down.
them in the weight room and you're like, no. So just think about that, and if you're able to gather as much information as you can, even when you walk in and they say, you know, take me to the weight room. Are you sure? Right? Same thing happened yesterday. We called a sepsis alert, and they were like, they're fine. They're not fine, right? I've already done an assessment and determined this is what I think is going on. I might be wrong, but the waiting room is not a proper place for this person. So just everything that, all the knowledge and education that she's given you today, you can apply this obviously to not medically complex people as well. You might go pick up a patient who, through your assessment, you determine like, wow, there's a lot of different things going on. And when they say, go to the waiting room, nope, I'll stand right here until you have a bed for me. I don't get off till 8 a.m. and it's 6 o'clock at night.
You're not just a clinician, you're an advocate. You're a voice when they don't have a voice or have that basic knowledge. I mean, let's take it one level up. How about her mom?
As of right now, I can't drive. Like, as of today is probably my last day of driving distance. I'm looking at hiring somebody for that because I passed out twice behind the wheel last week.
But again, think about her mom. Because what does her dad have? And now she's torn between her daughter being routed to a hospital and being not listened to.
Teddy.
The amount of pressure, that part of it, that kindness, how you respond to something or talk to somebody in their house, that's massive. Because she is just as much a victim
Can you sit?
in the whole.
He can sit.
Whether that's because everybody she loves is a disaster. So again, maybe that's where you get a Connect program that can give a little support somewhere, like it's taking it to the next level. But think about the mom, think about you, if you were in those, how you say something, how you respond to someone can make or break them at that moment, if you think about it. The human aspect is what this is about. It's not just being a clinician, load and go, hurry up, go to the closest facility. It's so much more. Even if it's once a year. Think
Yeah.
about the people with high-tech kids. Some of you may have autistic kids. Nonverbal autistic. She's autistic with ability to communicate. What about the ones that are nonverbal? And
Lay down. Go lay down. Yeah. I'm an open book, so if you have questions, I'm happy to answer. My Google Drive, if you like reading weird articles, has 40 to 50 articles on Ehlers, Danlos, and related conditions. It's public. I'm happy to give that link. I have a video series that I did in May. It was Ehlers, Danlos Awareness Month. I tried to do a video a day. If you look up my name, it comes up on Facebook. All that stuff. So happy to help anybody. If you have any questions, she has my number and probably my email.
Do you have that license?
What's up?
What has your access been like to care?
I am extremely fortunate that I have the ability to travel and I have fantastic health insurance and financially I'm more stable than most.
Well, I guess more like, given like the information that you gave today with like your different diagnoses,
Oh, it's crap.
like in this general area.
I will not go back to VCU anymore because of the policies they have in place. They refuse to start TPN because of a hospital policy. Their vascular surgeon, I have a letter from VCU admitting fault on his part because of the way he spoke to me and the assumptions he made. Head of vascular had done less than 10 to 15 surgeries with my condition. On the last day I was being discharged AMA. He had diagnosed me in May, said absolutely. But when I went in there, he's like, a lot of the women I do this surgery on come back and say they regret it. In those words. Again, I was admitted, so he was called. I didn't want to see vascular surgery at this point. I said as residents, if he doesn't want to come talk to me, I'm not talking to an intern. On a surgery the head of vascular has done 10 of them on. I'm sorry, that's an idiot move. They sent him in as they were trying to discharge me because it was every department had to meet to agree there was no solution. And I have a recorded conversation of the attending saying, for your safety, you need to leave. He came in and said there was no way had I had those symptoms that he would have diagnosed me. I'm like, gastroparesis has been in my chart for 5 years. And he's like, yeah, how's that happen? It's EDS, all of this. And he's like, oh, I had no idea. I'm like, the basics of EDS. You have no idea. I can Google this and it can come up. And you're offering to do a surgery on me that has a 6-month recovery with complications? And he did it when he knew he wasn't supposed to come in that room alone because of how he had spoken to me prior. My parents said, do not come in without us, do not come without a nurse supervisor. And he came in and woke me up to have that conversation. I have a letter from VCU saying that. My primary's hands were tied there. The autonomic neurologist there, who I need to get out of care and I'm transferring, thinks that POTS is caused by PTSD and trauma, and we need to go to therapy. And that if you fix our heart rate with meds and puts us back on the tilt table, it was a therapy problem. He can't get his article peer-reviewed, wonder why. Allergy won't see me because I have a KIT mutation. Nobody in the state will see me for my allergy, so I go to Duke for that. There's no motility department anywhere pretty much anywhere in Virginia. VCU doesn't have one, UVA doesn't really have one, and they kicked me back. So the only motility GI I can go to is at Hopkins. And he wasn't taking patients. He doesn't take patients in years. The Ehlers Danlos group is like, how the heck did you get into him? He does, and if you do, it's a year wait. I was in within 10 days. So, and palliative care is not easy to access for somebody without cancer or terminal diagnosis. Because of my situation and the care I was getting, they have accepted me. So, yeah, it's bad. You have a rare condition, it takes years to get diagnosed, you are gaslit, you are treated horribly, and a lot of times you have to travel. When I started, I actually went to Mayo to start trying to figure out, because they have all the specialties, get it done. They do it in like a week, right? Yeah, they diagnosed me with an eating disorder, said I didn't have POTS. It was due to GI deconditioning from the eating disorder. So that's the level of care I've had over the last year and why I avoid everybody. And keep in mind, I can talk medical, I can communicate my needs, I can research what I have. I know what specialties to go to. I'm extremely privileged because I have that background. I've had to do this myself. All of this had to be done by me.
So when I first met her and we started talking, she referred to EDS. I had no clue what she was talking about. So I asked the question, I'm not familiar with that. Can you give me a breakdown? And they share with you. So when you're not sure of something, when you get a call, and you, sometimes when we're assessing, we don't have time to Google, then ask the patient, say, I'm not familiar with that. Can you just give me a brief overview of your condition to help educate me make the right decision? It's very easy to say that, but we need to teach you to say that.
And I think
I've had it, so, you know.
in this binder, and I made it easy to find, they're a different color, the yellow sheets on my rare conditions and how to treat them. There's 3 of them, and ones people haven't heard. Mast cell, and the emergency protocols for mast cell in general. There's 2 of them here. There's one on MALS, which is my vascular compression, which nobody has heard of. And then there's one on Ehlers Danlos and how a practitioner can assess us and basics of it. It's here.
So now you see the load and go, hurry up, get out the door, treat your patients like you do your automatic alarms or smoke in your smoking structure. Do a 360, check the A through the B side, do you have a basement or not? Every patient, eyeball the room, take a look for those medical alerts. And look on those medical alerts, because like on mine, just from being no blood products, if you look on the back of mine, I have my name and my emergency contacts for you. So now I'm no longer a name debt in your system. Like, don't be afraid to look for those things. And people do wear them as jewelry. So always just get in the habit of looking. And a lot of people are clicking the scan bars to their Apple Watch band.
It's right here. I mean, it's clearly marked with a medical. You know what I mean? It's got the, I can't remember the name. It starts with an A. I can't remember the name of the snake thing, but that. Yeah, thanks, sorry. I know it was made by, anyway.
It took years.
Okay, I'm good. I'm like, I know the snake thing.
It's like, I can't say what EDS is, I know what it is. The pronunciation doesn't come out of my mouth, but I will tell you, since meeting her and learning more and researching it, I now know 8 people with it.
It's going to be diagnosed more. Doctors are finding out what it is. POTS is being diagnosed more because of post-COVID, and you're seeing it because of post-COVID.
And it's got a high genetic marker or a high marker with Epstein-Barr history. So
Lyme, Epstein, PANDAS. Yeah.
And, you know, doctors years ago, I'm like, well, what's Epstein-Barr? Like, oh, nothing to worry about. It just came up in your, because it's anybody who has had mono usually will have a marker of Epstein-Barr.
And can lay dormant, yeah.
Those are the people that don't vaccinate well. There's something with that Epstein-Barr marker that changes your receptors and how you respond. So those are the people that often get Guillain-Barré post a vaccine. You know, that's where that is. But Epstein-Barr, and something just the other day on the news, they were affiliating with an Epstein-Barr marker. So when somebody says that, that's another flag to say, okay, this is not black and white. This could be something more. Just look a little deeper, ask questions. But if you don't know what the disorder is, don't be afraid to ask the patient. They will be more than happy to tell you.
What's your normal? What's your normal? My heart rate daily can go 140 to 160. Fine. Fine. 180 SVT. Fine. As long as it's not sustained. My resting heart rate laying down is normally about 60 to 70. So if I'm laying down and you hear POTS, you might think automatically it's going to be high. It's not. But your vitals are going to be very different when I'm sitting, standing, and laying down. Right? So I'm going to think about what's your normal, because my normal temp is not 100. So.
And 100 to her could kill her, whereas 100 to us is a baby teething. So, just like your dementia patients, right? What's the norm? may alter your Alzheimer's patients when you're going to them, they're agitated, is this their norm? Yes, no, they're more agitated. Don't be afraid to ask about it based on this. We're learning more and more medicine. We want to put everybody in a box, this is the protocol that it's in, but it's more, there's way more to it. We all aren't in the same box at all.
And it statistically affects women higher than men, and neurodivergent women higher than men. We're not going to get taken care. We're not as seriously taken care of by the system. So, happy to talk about more. If you have questions, you know how to get a hold of me.
And she does, she'll text right back.
Yeah.
However you want to talk to her or ask questions, I mean, she wants you to know while she can still share it with you, her experience, and, you know, I mean, she's your all lead. Let's be real, she's not my age, she's your all lead.
So are there, do you know many more people that have similar conditions as you? And are they?
Oddly enough, a lot of them I worked with, vet med, because we're neurodivergent women. They get diagnosed later. I know a lot of people there, a lot of people online. It's a very active online community because of how we generally have been treated. We have to find our own information. And I am not allowed to smack a doctor online and say their name and what happened anymore, so that this doesn't happen to one more. My saying online, I work within a group behind the scenes called Invisible No More. That's for chronic illness, chronic pain, and chronic mental health issues. And it's not just a vent group, and it's not just EDS. It's a, yeah, it sucks. This is how you access care, but how you're gonna live your life despite the sucking. But there's two sayings I use in that group. One is I do a lot of this so one more person doesn't go through what I had to do. One more person has easier access to information. The other one I say, and this one might resonate with you, is a healthcare decision, your doctor's decision or your decision has impact, that moment, your 30-second choice has an impact on my life, and it can be a permanent impact. Your decision has consequences for my life. So, you know, you don't want to take the time, it's kind of where I am. Yeah. You're welcome. I gotta go get, I'm not in the mood today. I found out tomorrow I probably have to have bilateral injections in my shoulder. It hurts. It hurts.
She popped that hip out on me on the.
Oh yeah, if you want it, like it's literally, you can feel it. I don't know if you don't do ortho?
I'm good.
My thumb is, no? Not disconnected? No? Nope, you good? Shoulders aren't in. Took them 45 minutes last week to put my joints back in their socket. My back was corkscrewed. Yeah.
Meanwhile, we're looking to pull out the fentanyl and get some pain.
Who, which one?
Anybody likes
Oh yeah, no, fentanyl doesn't frickin'.
was the place for me where I gave more pain meds.
Thank you so much.
No, thank you.
Yeah, I recorded it today because I won't be able to talk in the fall, and I'll put it on the YouTube and stuff, so I told her that. Thanks. Hopefully surgery. I'm hoping to get this taken care of. That would be be great not to, you know, continue.
To first aid, soaking
Thanks.
wet and air conditioning. So then, and the kids.
Yeah. And I can't have surgery. All right.
Guys, you can take a break. We'll come back at 11, right at 11 and do some drug tests.
I've said 3 milligrams, do it. No, you need to put. That's great.
Thank you.
We're gonna work smarter, not harder.
I know. I'm like, it's just going that way this week. It's just not. Nah, did you see? They put new casters on it last night. My dad, he went to, oh my God, he went to Ace and got the good ones. And he's like, if this breaks, I'm taking the casters. He got the good ones.
Oh, yeah.
Yeah. Loctited that thing.
Thank you very much.
You're welcome. Sure. It's just kind of going back in the bags, and then I'm gonna figure it out. This is going in my backpack, just because what it is. And I had my allergy. What? The stuff I might actually need.
For lunch at 11:30.
Thanks. Yeah, the trainer's there if you need it next.
Yeah, excellent.
That's going in here. Sorry. No.
Anything they want in
No, all of it can go in there. Any of it, yeah, go ahead. The backpack's just heavy, so I put it separate. Oh, there's no messing up this. This is just a shove and put it away at home.
I'm sorry you had that experience with the EMS and all that.
It happens,
Hopefully
right?
you feel that we've been
Really?
respectful.
You have, yeah. It's hit or miss.
Did you say you wanted
That's it's heavy. You know what I mean? Yeah, you're good. Oh, anyway,
respectful, not offensive.
yeah, just how you treat people, unfortunately. Thanks.
Well, I hope you feel we've been.
I appreciate. Yeah, that's why I do this. Is maybe one of you won't pull that crap, you know?
You say you play games to distract you from all
I
that stuff?
don't. I'm not a gamer, but I do crafts and like music and stuff like that. I'm online a lot.
You want this on there?
Yeah. And let me put this in one of them. But yeah, no, I do a lot of.
We know what to do.
Also, I can.
We know what to do.
It's all good. Thanks. I'll collapse those too. I hate them. You start hating all this stuff. Like you look at your meds and you're like, that's trash. Let's dump that.
You want us to waste it here?
Yeah.
That's fine.
You don't want to touch that. It's sugar water. You can just put it.
You could just throw it in
You can just throw it away. Yeah, I didn't know how heavy that bag was. You know what I mean?
Yeah.
It's straight Dex. If you look at it, it's like
Dex, and that's why I was asking.
it's like almost straight sugar water. Yeah. Huh? Yeah, that's what it's for. That's where you get most of your calories from.
Oh, no, that's why I was asking.
Oh,
your
yeah.
medical condition with the hypoglycemia earlier.
Yeah, the calories are calculated based on lipids and dextrose. And right now I'm not tolerating lipids. So anything I eat has to have fat in it to try and manage that. And my labs aren't stabilizing the way they want. So that's why we're running out of time.
Do you eat really at all, though?
Yeah, a little, but not enough, and it's not absorbing. So it doesn't, I eat a little and I eat what I want. So like, you know what I mean? Because even if I drink something, it hurts. So when I drink, I enjoy it. You know? That's kind of how I feel about it. Oh, keys. Thanks, yeah. And I literally just bought a new car a month ago.
What'd you get?
26 RAV. They aren't releasing, they're special order right now. But I literally just bought a new car a month ago.
I was gonna say, it looked new.
Yeah, I just got it, and I ordered it in like April. Wait, end of March. I am pissed. I think I got it. Thanks. I appreciate it. All right, yeah, you can tell.
That banana bag.
Yeah, it's trash. Yeah, I was like,
Keep it here. This one.
you can use it for demo if you want, but it's straight sugar water, so you may not want to mess
No,
with
that's
that.
fine. It just shows them what it is.
Yeah. Tedford, where'd you end up? Teddy, you can come here. You don't need to nap. Come on. Time to go. Come on.
Oh, you got your treat bag?
Oh, no. Come on. We got to go. Time to go. Come on.
What did you say happened with the doctor?
Which one? Oh, I have the letter on my phone if you want to see.
Like you and G.
Oh, he said horrible things to me.
What did he say?
That women regret the surgery with him, that there's no way he would have diagnosed that if he had known my symptoms or my previous conditions. It was
The carrot cake's yum.
pretty gnarly. I have it in here somewhere. There you go.
Regret the surgery?
Yeah, having the surgery. That's his grievance. That's the letter from VCU admitting fault.
That's
I don't mind sharing it. I don't mind trashing his name.
exaggerate on y'all.
I literally was told by an attending to leave. It's bad. It basically has his side of the story, and then, yeah, he should have known better.